The term cutting off your nose to spite your face is used by me frequently in political conversations. There are many examples of this. The Club for Growth, in putting one of their own up for the Pennsylvania Senate seat in the Republican primary instead of backing Arlen Specter, because he is not ideologically pure, is one example of that. They basically lost a Senate seat because their goal of ideological purity is flawed. There are liberals in Louisiana who are also willing to cut their noses off to spite their faces by opposing Senator Mary Landrieu. Even though Louisiana's support for John McCain and Bobby Jindal last year and the year before proved that Louisiana is not ready to support anything other than a centrist type of Democrat. So when people on the left got angry at the idea that the public option might be off the table, I thought to myself, here we go again. What people need to realize is that it's not the public option that is important. What is important is what the public option brings in the overall healthcare plan. And that is healthcare coverage for every single person at a price that they can afford. Because that is the overall goal. Or at least it should be. What we should be working on are these points in any overall healthcare plan. Universal coverage. Everyone should be covered by some plan, be it Medicare, Medicaid, the VA, their employer, the federal health care plan, or the National Health Exchange. There should be universal minimal benefits. Every plan that is offered in the United States must have certain benefits. Of those must be A, no coverage maximums annually or lifetime, B, minimized out-of-pocket expenses, i.e. the amount of co-payments, co-insurance, and deductibles that a person would pay as an insured, and they should not exceed a certain threshold. C, no denial of care because of pre-existing conditions. D, coverage of preventive services with no cost sharing passed on to the insured. And E, coverage of all medically necessary services, as well as services that are meant to streamline service to make it more efficient. If all of these are achieved, the country wins. And do you really think that the person who currently lacks health insurance for his or her family cares if the insurance that covers them is a public plan, or if it's part of the federal employee's health care plan, or part of some nonprofit cooperative, or it was held by a private insurer? Of course they don't. All they care about is that they can get vaccinations for their kids, prenatal care for their wives, and other preventive care that will make their trips to the ER and their reliance on the emergency room less frequent. And do you think that the people who lack insurance for their families are going to be happy with a bunch of Democrats who didn't get them the health care that they needed because the Democrats couldn't get what they wanted in the form of a public option? That is just going to make us on the left look like spoiled whiners who didn't get our way, so we took our ball and went home. These people voted in huge numbers to give Democrats a supermajority in both houses and the presidency. To squander that because you cannot get your ideal is not only selfish, it is harmful to those that you are supposedly fighting for. Here's a news flash. Any healthcare reform that would finally get passed was never going to be perfect. And any Democrat who would vote against a healthcare bill that accomplished all of those stated goals, as I stated above, but didn't have a public option, are just as guilty of keeping healthcare reform away from the uninsured and underinsured as the Republicans who are currently working to kill this bill.